The Zika virus disease is mainly asymptomatic, and when symptoms occur, they are often mild. However, severe neurological outcomes have been associated with the infection, such as microcephaly in newborns whose mother was infected during pregnancy, and Guillain-Barré syndrome (GBS) in infected adults. Our systematic review summarized the effects of these two neurological syndromes on health-related quality of life. On the 4th of July of 2019, we searched 6 databases for publications with the terms quality of life and microcephaly or GBS. We included primary studies regardless of study design, publication date, or language. All the stages of the project, from title and abstract screening to data extraction, were conducted independently by 2 reviewers. From a total of 1,751 studies screened, we included 21, 1 on microcephaly and 20 on GBS. The most common methods and instruments used to measure health-related quality of life or derived utility values were the SF-36, used in 8 studies, the SAP, used in 4, and time trade-off, used in 3. 15 of the included studies were cross-sectional, 5 were cohort studies, and 1 was a randomized controlled trial. The included study on microcephaly derived at this utility for children with microcephaly of -0.82 from a perfect health threshold or -0.75 from a normative threshold. We found 3 studies that derived time trade-off values for GBS, which varied from 28 days for seniors to 1,095 days for a 1-year-old child. Studies that followed up patients with GBS found an improvement between 45 and 70% during the first 6 months of the disease, and stabilization after the first year, with a total improvement of 80% or more. Studies that compare quality of life in patients with GBS and controls found a great reduction in quality of life of patients during the first year of the disease, with most studies reporting a reduction between 50 and 60%. After 1 year of onset of disease, most of the studies reported a lower reduction, around 10–15%, when compared to controls. Some of the more relevant conclusions of our study were that the lack of studies investigating quality of life in patients with microcephaly is striking, and there is a great need for more studies to fully understand its impacts on patients' quality of life. For GBS, the physical impairment primarily affects the physical and daily activities domains of the health-related quality of life instruments, and the overall long-term quality of life in patients with GBS can vary substantially, depending mostly on their functional status in the post-acute phase of the disease. Please feel free to contact me if you have any questions or comments on our study, and thanks for watching.